Late Night Health continues. Our guest is Dr. Geoff DePaula. We're talking about getting the best care for patients, and we'll have a link to Dr. Geoff's website so you can find out more information about him and what services he offers. If you're not in the Boston area, he also offers telecommuting kinds of programs, and we'll talk about that, right now. Let's talk about diabetes. We have an epidemic of diabetes or pre-diabetes in the United States. It's been attributed to lack of exercise and the fact that we eat too much white stuff. What is your approach to help diabetics?
Yeah, so, I was in the clinic since 2000, and about 7 years ago, I decided that I needed to share integrative medicine with more people. So what I did was I created a company called IM Health, Integrative Medicine Health, what that stands for. And basically what we do is a type 2 diabetes telehealth disease reversal program. So we work with people anywhere in the world where they have high-speed internet and a phone, and they work over the course of a 16-week program. They basically are reversing the disease process. So we actually did a pilot program. Yeah, we did a pilot program with a university back in 2012, and with Harvard Pilgrim Healthcare, which is the number one health plan in the country. And what we found was we tracked the claims cost, and we tracked the hemoglobin A1C, which is a blood work biometric marker that tracks your 90-day blood sugar average. And what we found was not only did we take people from diabetes to pre-diabetes and get them off insulin and help them lose 30 pounds, and we did it in half the time of a low-fat vegan diet, and we did it in a fraction of the time of the American Diabetes Association recommended program. And our program was, our A1C reductions were more than twice, and we did it in half the time.
That's amazing. What about compliance? Because that's in any healthcare professional, they all tell me that compliance is a problem. It can be as low as 50%.
Well, compliance assumes that the patients should do what they're told.
Yes.
Patients don't do what they're told, and that's a fact that physicians haven't quite woken up to yet. So patients do what they want. People do what they want. So we don't work with every diabetic. We only work with people who want to not lose their legs and not go blind and not be on dialysis and have kidney failure. We work with people who want a different future than the medication and future that their doctors and diabetes educators are providing to them. We're giving them an integrative approach which allows them to actually reverse the disease process, reverse some of their complications, get them off insulin shots.
And what about things like
metabolic syndrome?
No, not metabolic syndrome. It's a drug, often
metformin.
Metformin, that's it.
Yeah, metformin. Metformin is an oral medication. People can come off of that as well, depending on the severity of their disease. But absolutely, it's a possibility.
One of the problems with metformin, one of the problems that I understand with metformin is you start at one level and you keep needing more and more and more,
right.
Which is not a good idea in my way of thinking.
Yep. It is true that a lot of people get desensitized to the diabetes medications, which is part of the reason why it's a progressive disease. They're not addressing the underlying causative factor.
Is the underlying cause, by the way, of diabetes our diet and lack of exercise? Would that be simplifying it too much? Or
that's only a piece of it. And then it's also, if you say what's the right diet, if you ask a diabetes educator, a nurse, a doctor, an endocrinologist, they're all going to give you a different answer. The reality is that they're not following best practices. They're not following evidence-based best practices. Our program we did back in 2012, we believed was evidence-based best practice, and then the Journal of Nutrition came out with a huge meta-analysis in 2015 and said, hey, this is the best approach for people with diabetes. And guess what? That was the exact approach we were using. So it was confirmation to us that we were on the right track. And when we looked at the claims data from Harvard Pilgrim, we found that we were saving about $5,900 per patient in the first 12 months because people were getting better and weren't needing as much medical care.
So they didn't have to go to the ER? They didn't need their legs amputated? They didn't need more prescriptions?
Well, they actually needed less. I mean, they came off of insulin.
Right.
Insulin can be $300 to $1,000 a month. So that money the company saved.
That is...
people who didn't do the program, who were diabetic, their costs went up about $2,500 from 1 year to the next. And people who did do our program, their costs went down about $3,400 per
Well, I have to
per person.
I have to thank LinkedIn. Dr. Geoff found me on LinkedIn, and I'm glad he did. Dr. Geoff, thank you very much. What is your website? People can find you at?
The website is www.imhealth.com.
IamHealthy.com.
No, just I Am Health. The letter
Health.
I, the letter M, and then the word health.com. Yep.
Got it. We'll have Dr. Geoff back. I know we will. We appreciate your time. Coming up next, another doctor, Dr. Dave Foreman, registered pharmacist, the herbal pharmacist, joins us to talk about addiction. I'm Mark Alyn. Be sure to join us at latenighthealth.com. We'll be back. Don't go away. More coming up.